Welcome to our 5 on 5. Pleased to be joined today by Angela Dowling, the president of Regence Blue Cross Blue Shield of Oregon. Good to see you. Thanks so much for being here.
Thank you. My pleasure.
Yeah, so you spoke recently at the Medford Chamber. Tell us, what was the focus of your speech?
Well, it was a pleasure to be invited to talk to the Chamber of Commerce. I have to tell you, they have a full room of individuals and business owners, so it was great to be a part of that. We were talking about some of the national changes that are occurring within healthcare, as well as some of the local trends that are occurring, as well as some transformation in terms of technology and how to empower consumers in making decisions around their healthcare. So it was a very lively conversation.
Okay, and speaking about the economy, what role do health benefits play in our national economy today?
So as the economy continues to progress and improve over time, and it's on a great run at this point, unemployment tends to decline, which is fabulous for those individuals looking for jobs. But if you're an employer, the #1 challenge they have is finding talented, qualified employees. And so salary is always part of that conversation. But in addition to that, employee benefits play an incredibly important role. So right under salary is the employee benefits that they're offering. And at Regence, we offer employee benefit solutions to employers. And employers are increasingly looking at benefits as a way to attract those new employees and then retain those employees that they currently have on staff. So it's an incredibly important role, regardless of the economy, but especially as the economy continues to progress in a positive direction.
Okay, and regarding the individual healthcare experience, how is that changing? And you referenced technology earlier. I imagine that plays a big role in that.
It does. Over time, and as we continue to evolve in the healthcare arena, technology becomes available to consumers. So transparency is probably the #1 technology and use of technology, and that is transparency around cost, around providers who are accepting patients, around quality, and then also around pharmacy transparency is a fabulous new technology that's rolling out, and we're rolling it out to a lot of our customers. And that allows you really to determine when you get a prescription from your doctor, you don't always know what the cost of that is. Sometimes you go to the pharmacist and there's sticker shock relative to the cost. This allows you as a consumer really to understand the effectiveness of a medication, what other alternatives there are in the pharmacy space that allow you to make choices relative to the pharmaceuticals that you may be consuming. And so that also in partnership with your provider, working together to make sure you're making the most effective and reasonable decisions around cost and effectiveness. Okay. Technology will play a very important part going forward.
Okay, we're going to take a quick commercial break.
Okay.
Much more with Angela in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Angela Dowling, the president of Regence Blue Cross Blue Shield of Oregon. So we were talking before about technology and how it's changing the game, so to speak. What about rural Oregon, where some people are down here and need to see specialists that are only available in Portland? Does technology helping close that gap? Do you think that's happening?
No, that's
more?
a great question. Yes, technology absolutely closes that gap. It allows people to do teleconferences with specialists where they actually can be at their home and either via their smartphone or their computer able to actually connect and have a conversation, a visit, a consultation with their specialist, regardless of where their specialist is at. And I think that's one of the great technologies that's rolling out, is it allows access and broadens access to care where sometimes people would have to travel hours or an hour, which is very inconvenient for a 15-20-minute consultation, when now you can do it over the phone or via your computer. It's an outstanding technology that I'm thrilled that we're able to roll that out, and I hope more and more people take advantage of that. So far we have a couple people taking advantage of it, maybe 5 to 10% of our membership base, but we're hoping that that'll expand pretty dramatically over time as people start to understand the convenience.
Certainly, yeah, they just have to do it once and then they're in, I would imagine. Okay, so what kind of presence do you guys have here in Southern Oregon, Rogue Valley?
We have a strong presence. We have about 250 employees that actually work here in our call center that services a little over 2 million people. It's an award-winning call center. We're thrilled to have these employees here who are servicing our members. It contributes about $10 million to the Valley in terms of economic stimulation, and so we're thrilled to be part of the community. We're going to continue to grow this call center. They provide outstanding service to our membership, so we continue to to grow in that space.
Okay, and I understand you guys have a partnership with SMART at Kennedy Elementary School. Why is something, a program like that so important to Regence?
Well, SMART stands for Start Making a Reader Today, and getting books in the hands of young people, into elementary age school children who can learn to read and progress, makes them healthier over time. Studies have shown if you learn to read early on, you become more adaptive and can continue to progress in your education going forward. And that helps make a strong community, and that helps all of us. So absolutely, we're strong partners in that. We have been for over 5 years and contributed in the state of Oregon about $200,000 to that program. And we're thrilled to be a part of it.
All right, very good. Great to see you. Thank you so much for being
you.
here today. Appreciate it. All right, stay with us. We'll be right back.